Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about what does it mean if your blood test shows high leukocyte levels. You will receive values for leukocytes and other blood components during a full blood count. Leukocyte counts that are greater than usual are a symptom of an abnormality that requires quick attention. Leukocytosis is the term for the state where the leukocyte value is excessive. White blood cells are referred to in medicine as leukocytes. White blood cells' primary job is to protect the body against illnesses. Leukocyte levels that are abnormally high indicate that the body is experiencing a condition or anomaly that the white blood cells must fight. The value derived from the leukocyte examination results can later be utilized to aid in the detection of various medical illnesses. The effectiveness of chemotherapy or radiation therapy for cancer patients can also be evaluated using this test. Body's normal leukocyte count. The units per microliter of blood are used to determine this value. Leukocytes typically differ in value between men, women, adults, and children. Here is the value. Men, 5,000 to 10,000 leukocytes per microliter of blood. Women, 4,500 to 11,000 leukocytes per microliter of blood. Children, 5,000 to 10,000 leukocytes per microliter of blood. Normal newborn, 9,000 to 30,000 leukocytes per microliter of blood. Children under the age of 2 years, 6,200 to 17,000 leukocytes per microliter of blood. Depending on the kind, white blood cell counts can also be performed with more specificity. The 5 primary categories of white blood cells are as follows. Neutrophils, 40% to 60% of all normal leukocytes. Lymphocytes, 20% to 40% of all normal leukocytes. Monocytes, 2% to 8% of all normal leukocytes. Eosinophils, 1% to 4% of all normal leukocytes. Basophils, 0.5% to 1% of all normal leukocytes. General causes of high leukocyte levels. Leukocytosis is another term for a high leukocyte count. There are numerous disorders that might result in this condition. High leukocyte concentrations can result from the following conditions: infection, immunosuppression, consequences of using specific drugs like corticosteroids, bone marrow conditions, autoimmune conditions including lupus and rheumatoid arthritis, various cancers like leukemia and lymphoma, body inflammatory response, thyroid issues, injury, emotional stress, labor, pregnancy, smoking, an allergic response, extreme exercise, respiratory conditions including severe cough and tuberculosis. The quantity of the 5 different types of white blood cells can rise under the aforementioned circumstances. However, in other circumstances, just one or a few of the 5 different kinds of white blood cells have numbers that exceed typical ranges. The doctor may give you instructions to assess the leukocyte value on a blood test in greater detail based on the type of leukocyte present. Each type of white blood cell has a different disease-related signaling function as it increases. According to each of its components, the causes of high leukocyte levels are as follows. 1. Neutrophils. A rise in the neutrophil value can result in high leukocyte counts. Neutrophil leukocytosis is the medical term for an increase in neutrophil counts in leukocytes. Several situations can result in high neutrophil values, such as injuries, inflammation, and viral and bacterial infections, adverse effects of drug use, symptoms of certain forms of leukemia, heart attack, burns, and/or fracture. 2. Lymphocytes. Lymphocytic leukocytosis is the medical term for an excessive lymphocyte count. This occurs when tuberculosis or a viral infection are present in the body. Additionally, the existence of specific leukemia and lymphoma subtypes can be suggested by high lymphocyte levels. High lymphocyte levels can also result from hepatitis A, B, and C mononucleosis, pertussis, HIV/AIDS, hypothyroidism. 3. Monocytes. Monocytes are a type of white blood cell that aids in the removal of damaged or dead cells from the body as well as the fight against cancer cells. Monocytes simply travel from the blood to tissues like the lungs and liver a few hours after being produced. Monocytes turn into macrophages in these organs. When monocyte levels are too high, it might be a sign of chronic infections, autoimmune diseases, cancer, endocarditis, syphilis, sarcoidosis, parasitic infection, and/or joint collagen vascular abnormalities. 4. Eosinophils. Eosinophilia, on the other hand, is a condition marked by a high eosinophil count. Eosinophils work to combat parasite and fungal infections in a healthy body. There are various circumstances that might result in an excessively high eosinophil value, including seasonal sensitivity, asthma, an infection of the digestive system, myocardial autoimmune disease, vasculitis, and/or sarcoidosis. 5. Basophils. Finally, an increase in basophils might also contribute to a high leukocyte value. Basophilia is the term for an elevated basophil value. This condition typically results from arthritis rheumatoid, anemia hemolytic, hypothyroidism, chickenpox, and/or lymphoma. High leukocyte counts can have unknown causes. Idiopathic hypereosinophilic syndrome is the name of the disorder, which has the potential to worsen and cause harm to the liver, lungs, heart, skin, and nervous system. Signs of a high leukocyte count. High leukocyte numbers can also be identified by the occurrence of specific symptoms, including fever, body ache, bruise, extreme weight loss, sweating at night, bumps, redness and itching in the skin surface area, wheeze and breathing difficulties. People with high leukocyte counts do not necessarily suffer the aforementioned symptoms. It all depends on the illness that results in elevated leukocyte counts. White blood cells make the blood thick and prevent adequate blood flow in the body when the quantity of leukocytes in the bloodstream is high. This may result in issues like stroke, visual disturbance, respiratory problems, bleeding in the stomach, intestines, and other mucosal-lined bodily cavities like the mouth. Hyperviscosity syndrome refers to the aforementioned conditions. Although it is uncommon, this illness can manifest in persons with leukemia or blood cancer. If you suffer any of the aforementioned symptoms and a blood test reveals that your leukocyte value is higher than normal, you should seek medical attention right away to receive effective medical treatment. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.